Welcome to the Omni Dental podcast. Some statistics really they hit different. Today, we're plunging into a truly eye-opening one, dental fear. A brand new study from the Journal of the American Dental Association just dropped, and it reveals a staggering 72.6% of U.S. adults. I mean, that's nearly 3 out of 4 Americans admit to having some level of dread about the dentist. So our mission in this dive is to really unpack this. Why? Why is it so common? What's the impact, on our overall health? And crucially, what steps can patients and forward-thinking practices like Omni Dental take to make visits comfortable, even calm? We want to show you that, being informed isn't just about the problem. It's about the very real solutions available right here in Arlington Heights, Illinois, and our surrounding communities.
Yeah, it's really important to frame this not just as individual nerves. As you said, it's a widespread public health challenge. What it means stretches far beyond just, feeling anxious in the waiting room. But what's really encouraging and what we'll dig into today is that there are actual concrete strategies. There's a growing understanding of how to genuinely support patients through this.
Okay, so let's unpack that headline statistic because, wow, it's truly astonishing. This Journal of the American Dental Association study, it wasn't just scratching the surface, right? It surveyed over 1,000 U.S. adults. And the numbers, well, they paint a pretty stark picture.
They absolutely do. The study goes into detail on the prevalence. Out of 1,003 adults, 45.8% reported what they called moderate dental anxiety.
I think it's moderate.
But then another pretty substantial chunk, 26.8%, it described their fear as severe.
Severe. Wow.
So you combine those. Yeah, you're looking at almost 3/4 of Americans carrying this kind of dread. That's not just a large segment. It's practically, a national experience.
Almost everyone you meet then has some level of this.
Yeah.
That's just wild to think about. And for many people, it's not something that just popped up yesterday, is it? Our sources point to a deeper history, often starting in childhood.
Precisely. A lot of adults can trace their dental fear right back to a negative, maybe even traumatic early experience. And it often isn't just a vague feeling either. People remember specific triggers. Things like, a really painful procedure or maybe feeling totally helpless and out of control in the chair. Sometimes, unfortunately, it's even remembering being treated kind of harshly or dismissed by the staff. It really shows how deeply those early interactions can stick with us.
That feeling of vulnerability, losing control.
Yeah.
Yeah, that can certainly be powerful. And what's fascinating, or maybe worrying, is how this fear impacts more than just comfort during an appointment. It has real health consequences, doesn't it?
It's a critical point, really critical. When people deal with such intense anxiety, it almost always leads to avoidance. They skip those really important routine checkups, the cleanings. So what starts as maybe a small issue, like a tiny cavity or some gum inflammation, it gets left unchecked. It grows into something much more serious, often needing more complex, more invasive, and frankly more anxiety-inducing procedures later on. It turns into this self-perpetuating cycle.
Which is the very thing people are trying to avoid. The fear of pain leads to problems that need more painful solutions.
Yeah.
That's a brutal irony.
It is, and the ripple effect just keeps going. There's a well-documented link, scientifically understood, between poor oral health and conditions throughout the body. Chronic inflammation, bacteria from gum disease, they don't just stay in the mouth.
Right.
They can travel through the bloodstream, impacting other organs, other systems. So delayed dental care can actually worsen things like heart disease, diabetes, even respiratory problems. It really underlines that neglecting your oral health because of fear affects your whole body's well-being. And we can't ignore the emotional side either. Living with dental fear causes real mental distress, dreading appointments, anxiety, often feeling judged or ashamed about their teeth.
It sounds like such a heavy weight for so many people to carry. But our sources also show a pretty significant glimmer of hope, which is genuinely uplifting. The study actually found that over 71% of those with moderate to severe fear are actively interested in free, brief, at-home treatments.
Yeah.
It even mentioned promising new programs like Dental Fearless, using digital tools and telehealth to help reduce anxiety. This isn't just mild interest. It seems like a clear, widespread demand for solutions. Maybe a real turning point is possible here.
That's the hope. People want help.
So, given how widespread this fear is, the big question is, what are practices actually doing about it? This is where it gets really interesting, I think. How are modern dental offices like Omni Dental proactively trying to create an environment where patients can feel genuinely comfortable, maybe even safe?
That's the challenge, absolutely, but also the opportunity. At Omni Dental, under Dr. Bellis Pulse, we really get that overcoming dental fear isn't just about being nice. It takes a structured, comprehensive, and deeply patient-focused approach. It's all about building real trust. One of our core strategies, and you see this in many leading practices now, is really focused patient communication.
Okay.
This means truly listening, actively listening to concerns, figuring out specific triggers, understanding past negative experiences. We explain every step, every sound, every sensation in simple, clear language so you know what's coming. And crucially, we give patients control. We offer clear stop signals.
Stop signals.
Yeah, so you can pause, take a break, or even stop the procedure entirely if you need to.
Wow, that sense of agency must make a huge difference, especially if someone's past trauma involved feeling totally out of control. Giving that back sounds incredibly powerful.
It really is. Studies actually show that just knowing you have a stop signal can significantly cut down on perceived pain and anxiety. It restores that vital sense of control. And beyond communication, comfort measures play a surprisingly big role. A lot of dental fears are sound-related, right? The drill, the suction.
Oh, yeah.
So offering noise-canceling headphones or letting patients listen to their own music, that can be incredibly effective. We also focus on creating a calming atmosphere, warm blankets, comforting decor, soothing distractions like TVs or screens in the treatment rooms. These aren't just like superficial things. They actively engage other senses to pull focus away from the anxiety.
I could totally see how changing that sensory input could create a much more positive memory. It sounds like a real shift away from that cold, sterile image some people might have.
Exactly. Then you have relaxation and behavioral techniques. These
Yep.
can be super effective, practiced before and during appointments. Things like guided breathing, mindfulness, maybe visualization, picturing yourself somewhere calm. And for kids, but honestly for many adults too, the tell, show, do method is fantastic. We tell you what we'll do, show you the tool and how it works, and gently do the action. It just demystifies everything, gets rid of surprises, and builds a lot of trust.
So it's not just about distraction, but really explaining things and empowering the patient.
Yeah.
Got it. But what about for people with really severe anxiety? Sometimes those techniques might not be quite enough, right?
You're absolutely right. For those with higher anxiety levels or for more involved procedures, sedation options are critical. Nitrous oxide, laughing gas, is great for mild to moderate anxiety. It helps you relax but stay fully conscious.
Okay.
For more severe fear, other sedation or anesthetic options are available, always done super safely with careful monitoring. And we're also bringing in tech resources, kind of inspired by programs like Dental Fearless. We offer telehealth consults so you can chat about fears and treatment plans virtually from home. It lowers that first hurdle of just coming into the office.
That's a huge step forward. Really integrating modern tools into patient care. It feels like the whole profession is genuinely trying to evolve to meet patients where they are, emotionally speaking.
And underpinning all of this, continuous staff training. Our whole team gets ongoing education specifically on working with anxious patients. It's not a one-time thing. It fosters a real culture of empathy, patience, and being completely non-judgmental. Because ultimately, that human connection, that compassionate interaction is just paramount when dealing with such sensitive feelings about dental care.
So, Omni Dental's approach really seems to tackle those core roots of fear we talked about earlier. Addressing the loss of control by giving patients agency, managing pain with clear communication and sedation, and countering those bad past experiences with real compassion and respect. It's like a whole shift in how care is delivered. So what does all this mean for you, listening right now? We've talked about the scale of the problem and how practices like Omni Dental are working to reshape the experience. Now let's empower you. What practical steps can you actually take, both before and during your visit, to help genuinely reduce that anxiety?
Okay, this is where you become an active partner in your own comfort. First, I'd really encourage you to try and pinpoint your specific fears. What is it exactly? Is it the needle, the sound of the drill, that feeling of something in your mouth,
Right.
or just not knowing what's going to happen? Knowing exactly what triggers your anxiety helps you tell your dental team. It gives them a kind of roadmap to help you better.
Right, like knowing the enemy is half the battle. Once you can name it, they can address it.
Exactly. And another simple, but often really effective step, bring someone you trust for support. Having a friend or family member there, even if they just hang out in the waiting room, can provide a huge sense of comfort and reassurance.
Yeah, just knowing someone's there.
And practicing relaxation techniques beforehand can make a real difference too. Simple breathing exercises, guided imagery, maybe meditation. These can help calm your mind and body even before you leave the house.
I know for me, sometimes just putting on a favorite calming podcast or music with noise-canceling headphones helps shift my focus away from feeling anxious.
Absolutely. Distracting your senses is a powerful tool. Make a playlist, use those headphones, maybe even hold something comforting in your hand, anything that helps pull your attention away from potential worries. We also really suggest considering what we sometimes call non-treatment visits.
Non-treat.
Yeah, sometimes just coming in for a quick casual chat with the staff or even just a routine cleaning without any major work plan. It can be a fantastic, low pressure way to gradually ease anxiety and just get more familiar with the environment and the team.
That's a brilliant idea. Like dipping your toe in the wire without the pressure.
Yeah.
And if you are thinking about sedation, is it better to bring that up way ahead of time instead of waiting until you're already nervous in the chair?
Precisely. Yes. Don't wait until you're already feeling worked up. Talk about sedation options with the office before your appointment, maybe when you schedule or even during one of those telehealth consults we mentioned.
Okay.
This lets you have a calm, informed chat about what's available, what might work best for you. It ensures you feel totally prepared and, again, in control. This whole approach, being transparent about costs, benefits, timelines, and absolutely avoiding any kind of force or pressure, that's how we actively work to prevent creating new negative memories. It's how we rebuild that essential trust, hopefully turning fear into confidence over time.
You know, that statistic, 3 in 4 Americans fearing the dentist, it might seem daunting at first. But as we've talked about today, it also really presents a clear, profound opportunity.
An opportunity for change, for more empathetic care, and ultimately for healing and better health overall.
And that's exactly what we're dedicated to at Omni Dental here in Arlington Heights and for our neighboring communities. We are truly committed to providing gentle, respectful dental care that supports your emotional well-being just as much as your oral health. We really, truly believe that fear should never hold anyone back from having and keeping a healthy, confident smile. So thinking about all this, what small, intentional step could you maybe take this week? A step to begin reframing your relationship with dental care, especially knowing there are practices like Omni Dental out there, dedicated to your comfort and peace of mind. If dental visits do cause you dread, please reach out to Omni Dental directly. You can talk about your fears, ask about their comfort measures, sedation options, or schedule an appointment. Just call 847-483-8833 or visit their website to learn more. Thank you so much for joining us on this deep dive. We really hope this conversation has given you some valuable insights and maybe empowered you with practical ways to approach your dental care with a bit more confidence.